Thank you very much. Can everybody hear me? Okay. I want to start out by thanking all of you for coming here. It's a very good submission of your time. And thanking Elizabeth Kulas for all the extraordinary work she's done in organizing this very special meeting. She's worked many weeks to help out. Well, as you know, Lyme disease is a real problem in this country. Having been in the field of treating Lyme disease for many years, we can say that initially 15, 18 years ago, 8% of our practice was Lyme disease. Now every Lyme literate doctor that I know and Lyme literate practitioner sees 95% of their practice as Lyme disease. Does this mean it's becoming more frequent in the population, or people are waking up and knowing about it? We don't know, but it is a national epidemic and should always be considered that way. Now we know the history of Lyme. I'm sure you've read about it. It started in 1975, first identified a teenager in Lyme, Connecticut, and now presently it's been found in every continent in the world. We know that according to NIH statistics, 3.3 million Americans have been identified, but as Elizabeth and Kenneth have indicated, very little of this is reported to the authorities, to the regulators. 3.3 million Americans. Now, for example, think of this. We've had practitioners that have had Lyme disease reporting to us, sending us their patients, and they're now screening. They've had Lyme disease and have gotten over it. Now they're screening every single one of their patients, young and old alike, with the Western Medical Lab tests, the Western blot, usually Quest and LabCorp, which are only 60 or 70% accurate. And with this, they're getting an amazing level of 20 to 30% of all comers in the eastern Massachusetts area have antibodies. Now, antibodies mean you have Lyme disease. There's very little natural immunity to Lyme, unlike other diseases. It's very resistant, okay? If you express that, I've only reported 2 or 3 cases in 15 years. It's underreported. We know this. For many reasons, a lot of paperwork. The information is shelved by the regulators. It's not investigated. It's not published. And knowing that at least 20, 30 to 50% of Lyme disease, chronic Lyme disease, is silent, and it's underreported, and then unrecognized clinically when it's active, we get at least a minimum of 80 million Americans having it. And that's also, when you look at that number, you say this is the most common infectious disease in the country, very underreported, only secondary to flu and colds. And we know it's not very transmissible, so this is in the environment, okay? The other thing is that there are strains now. For many years, we've known that one of the strains of Lyme disease, the one that causes tick-borne relapsing fever, Borrelia miyamotoi, is not detectable on standard Western blot. You have to do a specialized antibody test, which some labs do. So even that is difficult to diagnose. In terms of the environment, we have to be very careful, you know that, to protect yourself. One of the major things you should do is always use tick spray on any excursion in nature. I myself have had tick bites being exposed just for a few minutes in nature without touching anything. A lot of people have had tick bites, landscapers, people that do work outside, and people that walk in nature a lot are especially susceptible. And one of the best tick sprays I found is the one that's sold at Whole Foods. It's called Nantucket Spider. It's very easy to use. You should use one that's clear so it doesn't stain clothes, and has multiple natural oils, not just 1 or 2. And this bottle is very ergonomic. You spray your whole body, all exposed skin surfaces, including your face and hair and neck, all inlet points, button-down shirts, the sleeves, the cuffs, and you should wear long sleeves when you go out in nature. If you wear shorts in the summer, you have to remember to spray everything. If you have a tick bite, you should contact a Lyme literate practitioner to learn what to do about it. There are many approaches now, but at least do something. And you should take the tick off with tweezers very carefully so you don't squeeze the tick and its contents into your tissues and infect yourself. There's a new remedy for tick bites and transmission. It's called a tick bite kit. It's going to be available in early June. It's put together by a naturopath that's a real expert in Lyme disease. It has topical essential oils, colloidal silver, and it prevents the transmission of Lyme disease, stops it cold, even after a few days of removing the tick. This avoids prophylaxis for every tick bite. Now in the past, tick bite prophylaxis has been handled with antibiotics, usually doxycycline, sometimes amoxicillin in those sensitive or very young or pregnant women. But the problem here, it's got to be, if initially it was given in one dose, a double dose, 200 milligrams, then it was spread to 3 days, and now it's 3 weeks. While the average person takes a broad spectrum antibiotic for 3 weeks, you're going to really disrupt your colonic biome, which represents 60% of your immune system. And the other unfortunate problem is recent studies have shown that the antibiotics suppress clinically the disease, but they do not kill the tick completely. They put it in a latent stage, Borrelia burgdorferi, the spirochete, so that many years later, after a silent period, you probably will be susceptible to the chronic neurologic sequelae, Parkinson's disease, ALS, Alzheimer's, MS, rheumatoid arthritis, lupus, scleroderma, all these things. It is not a very effective way of dealing with things. So the alternatives now are using the tick kit or using a series of herbs. Now people have varying opinions. Some use 5 to 10 times the normal dose of echinacea with angiographics, and you really have to see somebody who knows what they're doing here. But these are developing alternatives to handle the acute tick bite. And this tick kit works even after several days of the tick being on you when it's injected. It's spirochete. Okay, prophylaxis here is the key. You all know that rather than getting Lyme disease, an ounce of prevention is worth a pound of cure. It especially applies to Lyme disease. Now, what happens when you get acute Lyme? Well, the various syndromes, the most common thing is you feel like the flu. I don't have to go into this with you. You probably know all this. Flu, headache, anxiety, insomnia, sometimes arthritis, neuropathy, paralysis of the face. Only half the people, unfortunately, develop the typical rash, the erythema migrans rash, and more than half the people with chronic Lyme or acute Lyme remember even having a tick bite. So just the fact that they don't have a tick bite does not mean this is Lyme disease. The standard treatment in the past by most Lyme literature practitioners has been 3 months, according to Richard Horowitz, the standard, 3 months of antibiotics. But the problem here is you have to use multiple antibiotics. You have to get the cellular cell wall form, the L form, which is a cell wall minus form, and the cyst, which means you have to use a separate antibiotic for all three. The cyst, people have used Plaquenil, which is the favorite, Flagyl or Tinidazole, and either doxycycline for the L form or for the cell wall form, Augmentin, amoxicillin, or Ceftin. These are a lot of antibiotics for 3 months. You really have to protect your colonic biome by taking probiotics, as well as Saccharomyces boulardii, the friendly yeast, which prevents antibiotic colitis rarely, and the overgrowth like Clostridium difficile. So there are real setbacks of treating acute Lyme disease with antibiotics. And the other paradigm is what applies to the tick bite treatment of that also applies to acute treatment of Lyme disease. The antibiotics are good. They suppress acute symptoms. Right away, people feel better in a few weeks. But as I mentioned before, they result mainly in resistant organism. The spirochete becomes resistant and latent. Yes, occasionally you get a full cure with it, but most of the time you just develop latency and silent Lyme, according to the studies that have been done. So we've been looking for better ways of treating chronic and acute Lyme disease. I'm going to get into this a little later when we talk about chronic Lyme disease. We should also know that as with any type of Lyme disease, there is transmission in close physical contacts, sexual partners, families. It's not like flu or cold or sexually transmitted disease. We don't give safe sex advice, but there is transmission. Studies have shown that the spirochete is present in low-grade semen, vaginal secretions in those people that have it. So what we advise is when somebody has known chronic Lyme disease that's verified with lab tests or that's clinically very apparent, we try to tell them to screen the whole family to be sure. One of the ways that we can also treat acute Lyme disease is by giving, in addition to echinacea and high dose and andrographis, supplement, which I'll talk to a little later about, which is called Lymeplex Plus, which can be very effective, especially in combination. We talked about tick bite prophylaxis and protecting yourself. In nature, a lot of people are spraying their backyards, their grass, with DEET or using pyrmethrin cotton balls to prevent Lyme being transmitted by white-footed mice. But the problem here is white-footed mice is only one vector. There are many other vectors, so it may not be very effective. DEET can be a little toxic. You have to be careful of that. Red cedar oil is the preferred method. The spirochete loves moist, wet areas, but has been reported even on the north rim of the Grand Canyon when nobody lives and it's very arid, infected ticks there. So if you live in a nature area with grass, areas at a very high rate of Lyme disease, you may consider environmental control. Okay, how do we diagnose Lyme disease? Now, it's very apparent to us, the people that have had Lyme disease, patients, once they've had clinically apparent Lyme disease, they become experts in diagnosing other people. There's no other disease in this part of the world that can create the syndrome that Lyme produces, the brain fog, the fatigue, the arthritis, and the neuropathy. There's virtually no other infectious or autoimmune agent that's responsible for this. When somebody has the classic triad, it's almost impossible not to diagnose Lyme once you've seen a few cases. Unfortunately, it's not recognized by Western medicine. They're not giving any education. As a matter of fact, they're given negative information, disavowing the presence of this as a real illness. And what we often think of is, what do local primary care physicians do with the 20 or 30 patients with active Lyme disease that they see almost every week? How do they rationalize this as being nothing? Many patients, I see almost every patient I've seen has seen 10 or 15 specialists and primary care people. They've told them they don't know what's wrong, go to psychiatrists, on and on. Yet it becomes a real national epidemiologic problem. Diagnosing Lyme disease can be a little difficult at times. Most of the time it's fairly straightforward. We use specialized labs which are much, much more accurate than the standard medical labs. And you all have heard of IGeneX in Palo Alto, California. This lab specializes just in Lyme disease. They have a variety of tests. The standard is the Western blot, costs some money. There's a newer one called the immunoblot, which is 5 or 10% more accurate. They say about 95% accurate, but I think they're over-exaggerating a little. And then there are tests that test you for ongoing Lyme, ongoing ever-present Lyme disease. The antibody test, Western blot and immunoblot, only test you for antibodies for various agents on the spirochete. And although we think that there are very few people with antibodies that don't have active disease, it's possible. So it doesn't differentiate a past disease with a cure versus active ongoing disease. The lab tests that do that, the first one is called a CD57. It's a natural killer lymphocyte test. In IGeneX's hands, it's about 90% accurate. Western labs, LabCorp and Quest, about 60 or 70%. But even here we get false negatives. In any of these tests, there's no such thing as a false positive. If you have a positive test in any level, whether it's PCR, Western blot, immunoblot, it means you have the disease. Okay? The other disease for active ongoing disease is called I-spot Lyme by Pharmasan, or IGNX has the same test they call the IGX spot, which is very, very good. We use these to test the end result, the end stage cure or final treatment of Lyme disease, and the rule of thumb is 2 months of asymptomatic period, totally asymptomatic while on treatment, and then perform one of these 3 tests, and it should be negative. If it's in the right range and negative, you can stop treatment, consider yourself healed. Some people question whether this means cured, but we don't have enough testing and sophisticated ongoing testing to know. There are other ways to detect Lyme disease other than the clinically apparent way, and I'm sure you've all been familiar with muscle testing, which is about 75% accurate, pendulum aura testing, biomeridian, which tests the energy through electrodes, your acupuncture meridians, electroacupuncture by vol, on and on. So there are other personalized individual ways of diagnosing this. Okay, now we get into chronic Lyme disease, which most of the people with acute Lyme disease will develop chronic unless they're treated. This is a disease that has no natural immunity in the body. Okay, as I said before, we know now that 20 to 30% of the population has active ongoing Lyme disease. And we know that after many, many years of being untreated or treated unsuccessfully, it can result in many different chronic neurologic diseases. The main one, Alzheimer's, secondarily MS, ALS, Parkinson's, rheumatoid arthritis, chronic fatigue syndrome, lupus erythematosus, scleroderma, and many other autoimmune diseases. This has been shown scientifically. This has to be recognized, and what we ideally recommend is that everybody, young and old, be screened for Lyme disease with some sort of screening test, whether it's the standard Western blot through Quest and LabCorp or IGNX. This is most important because we do not identify any other disease in which 30% of the population is susceptible. So this demands national screening, and everybody should be screened periodically because you can get a tick bite anytime and pick up this disease. So that practitioners should realize some of the deficiencies of testing and should be aware of this. Now, we've talked about the disease. Chronic Lyme disease results in, as I said before, the triad: fatigue, brain fog, which means poor memory, being lost driving, can't remember what they did, where they put things at home. It's very apparent when they have this. Loss of words and vocabulary. Arthritis, not everybody has the arthritis, but it looks just like rheumatoid arthritis, symmetrical, multiple joints, and many people have the neuropathy. I'm sure those of you who have had Lyme disease have experienced these symptoms. The neuropathy consists of numbness. It's peripheral neuropathy in the hands and feet, numbness, pins and needles, spiders crawling under the skin, and then pinched nerve type pain that you would get with a herniated disc. So it's those 2 types. Occasionally Lyme disease acutely, and about 5% of the cases can cause acute emergencies, meningoencephalitis, and acute carditis, inflammation of the heart. Those demand intravenous antibiotics and hospitalization as one of the few periods. Years ago, we used to prescribe on those patients that were resistant to other treatments, intravenous antibiotics with PICC lines. But the body of Lyme literate physicians have gotten away from that, and my experience with this is what everybody else has had. After 3 or 4 months of IV antibiotics, you stop them, all the disease symptoms return. And it's not a permanent, it helps clinically, acutely, but it's not a long-term solution. It's expensive, there are complications, so we don't recommend that anymore unless there's a dire need for it. Okay, so antibiotics we use, as I said before, the important thing is to recognize that you have to treat every morphologic stage of the disease, the cell wall type, the L form, which is a cell wall minus type, and the cyst with different antibiotics, because most antibiotics don't cover all these 3. The standard is doxycycline, 200 milligrams twice a day. The cyst can be treated with Plaquenil, Flagyl, Tinidazole. Other than doxycycline, cell wall antibiotics consist of Ceftin, amoxicillin, augmentin, things like that. Now, the average patient, that's just the Lyme disease, and then you have to check for co-infections. And as you know, there are 3 major co-infections: Babesia, which is like malaria, Bartonella, which is like cat scratch fever, and Ehrlichia and anaplasmosis, which are like Rocky Mountain spotted fever. The hardest one to treat is Bartonella, because Bartonella can resist and causes personality changes and other things which can really affect the long-term course of Lyme. Some of the reasons that somebody does not respond to treatment is another tick bite with another transmission, inadequate regimen, poor compliance, and unrecognized co-infection. Unrecognized co-infection is very important with antibiotics because they're limited in their scope and they don't cover all the co-infections. And for Babesia, we use antimalarials. Bartonella's got its own specific antibiotics, as well as Ehrlichia. Half the patients have co-infections. Of those patients with co-infections, half are silent, and many of the co-infections do not produce symptoms anyway. For example, Ehrlichia or Anaplasma hardly produces any symptoms. It can affect lab tests like a suppression of the white count and platelets. But Bartonella is the one that has the most characteristic symptoms. I don't know, those of you who have had it might know personality changes, usually rages and changes in aggressiveness, abdominal symptoms, pains on the soles of the feet just in the morning, stretch marks on the skin, and eye pains and sore throat and lymph nodes in the neck. The more specific symptoms that they produce are not usually seen in Babesia. Babesia produces night sweats, fever, air hunger, can mimic the symptoms of Lyme disease, causing more depression, anxiety, and insomnia. Okay, going back to antibiotics, one of the problems with antibiotics is that they have to be considered for at least a year and a half. That is a long time to take multiple antibiotics. Very few patients of mine have been willing to do that. They get fed up with them, with the side effects, the changes in the colonic biome, and they give up antibiotics after 6 or 9 months. But the long-term treatment is necessary with them. And again, they produce resistance in many patients without a total cure. So they're very, very limited. You pay the price of side effects and alterations in the colonic biome, which, when you think about it, you're treating a disease which requires an intact immune system, and 60% of your immune system is located in the colon. So you have to, you take probiotics, Saccharomyces, prebiotics. It doesn't alter the fact that you have altered colonic biome, which is a real deterrent. And side effects. One of the most common side effects with doxycycline, I'm sure you're aware, is photosensitivity in sunlight. I've had patients that have complained in the winter through their sun shields in their car, they get rashes, they're so sensitive. And it's very difficult to let people go to the beach and outdoors in the summer when they're taking doxycycline with the photosensitivity and the sun rashes. Azithromycin produces hearing loss and tinnitus, ringing in your ears, on and on and on with the side effects. Flagyl, of all things, produces peripheral neuropathy, just what you want when you have Lyme disease producing this. So they compete, which produces the worst symptoms. So there's a lot of resistance to the use of antibiotics. Unfortunately, most of the Lyme world that's Lyme literate is still using antibiotics, and this is propounded by ILADs as the main form of treatment, but it is very limited. So what do we have instead? If we're criticizing antibiotics, we should have something else up our sleeve besides an ace of spades. And what I have found in the past with experience has been several years ago, after reading articles in holistic magazines about something called Orasal, which is a 4-component system consisting mainly of salicinium, which is a congener of sialic acid, which is one of the chemicals in your immune system, so it's mainly natural. We've had great success with that. Unfortunately, even though it has no side effects, it's a lot to take 4 different supplements. One is alkaline water, the other one's a probiotic with colostrum, and the other one is sodium bicarbonate. to enhance the effect on the colon of absorption of the salicinium. It also requires long-term treatment, just like antibiotics, 1.5 years, and there's an expense to this that you don't encounter with antibiotics. It's fairly expensive, but it does work, and it does have a general effect of healing the co-infections as well as Lyme. It was used initially for 10 years for treating cancer, very, very successfully, 85%. And you can use it initially intravenously for 3 weeks, which they do for cancer. It's not necessary to do this for Lyme disease, but it does have that advantage. Well, I had many patients on Oracel doing very, very well. But again, it was 1.5 years. It broke the kidney on many patients, so we looked for something else. Then about 6 months ago, a red flag came up. And I'm not exaggerating when I tell you this. A supplement company contacted me from the West, from New Mexico and Las Vegas. They had a supplement also they used for 10 or 12 years to treat autoimmune diseases, chronic infections, cancer, many testimonies from hundreds of patients successfully treated, diabetes. And they wanted to break into the Lyme market, realizing this was a real problem in many parts of the country, the East Coast, Northern Midwest, and the Northwest. So I agreed to give it a little try. And it's very, very simple. It's called LymePlex Plus. What it is a natural product, fermentation product from a natural group of bacteria, and it's a trade secret which bacteria these are. They're fermentation products, which consist of enzymes, proteins, and amino acids. But these are the same component in most body fluids in your body. So there's the detailed analysis with carboxylic acids and chemicals doesn't shed any light as to why this is so effective. Well, I started using it, and to my utter amazement and surprise, I was getting reports from patients after 2 or 3 weeks, 80% of their chronic Lyme symptoms had abated. And this is a consistent finding. I was also getting reports that maybe less than half of the patients had a little boost in their mood, a little euphoria, a little increased spiritual awareness, nothing overwhelming, but they were aware of this. And I now have 35 patients on it, and believe it or not, people, 100% success. Now, I can't tell you whether they're cured because the time isn't up yet to test them with the CD57 I-Spot Lyme and IGX Spot. That's coming soon. But as with all other forms of treatment, when you get silent periods, asymptomatic periods achieved by a treatment, it usually means if you go a little further, the 2 months of asymptomatic, you get a full resolution of the Lyme. So this is what we're approaching right now. Of these patients, I would say at least half of them have shown remarkable improvement in the first 2 or 3 weeks. There are people with rheumatoid arthritis that respond to this. This is a general treatment for co-infections as well as Lyme. So you save yourself the money in testing for co-infections, which can be $750 and only 60 or 7% accurate if you're using other methods like antibiotics. So this is a real breakthrough. And I'm finding that I rarely have to resort to any other form of treatment with this. It has no side effects, just like Oracel. The treatment course, listen to this, 2 to 4 months. Unlike 1.5 years, 2 years with the other forms, 2 to 4 months we're finding. Much shorter to become asymptomatic. If somebody has chronic neurologic sequelae, it takes longer, like Alzheimer's, ALS, Parkinson's. That can be 6 months, but it's never a year, okay? So this has many advantages, no side effects, and I should say limited Herxheimer's. The Herxheimer can be as serious as antibiotics and Oracel, but it's far fewer in frequency. It's about 50% instead of 90% with this. So we have a much shorter course, 2 to 4 months, instead of 1.5 years, no side effects, milder Herxheimer, and much more effective than anything else.